For 30 years, Healthy People has been providing science-based, 10-year national objectives for improving the health of all Americans. Healthy People 2020 includes social determinants of health as a new area of focus. The social determinants of health topic area is designed to identify ways to create social and physical environments that promote good health for all. All Americans deserve an equal opportunity to make the choices that lead to good health. In order to raise awareness and maximize access, podcast number 2 will feature programs and resources that address the social determinants and that are available throughout the state. First 5, Early Childhood Education and Development, SafeNet RX, Improved Access to Prescription Medications, USDA Rural Development, Financial Support for Critical Community Services, Food Bank of Iowa, Improving Access to Food for Food-Insecure Iowans, and Iowa Area Agencies on Aging, Comprehensive Services for Aging Iowans and their caregivers.
The first 5 years of life are a time of rapid brain development as trillions of new connections are made in the brain. During this time, children will develop language skills, self-confidence, and curiosity. They will also learn how to share and play and listen and follow directions. As a child is growing physically during these early years, she is also experiencing a crucial emotional development. It is important to remember that parents and primary caregivers are the #1 influence on a child's healthy emotional development. According to the most recent survey by the Child and Adolescent Health Measurement Initiative, more than 1 in 5 Iowa children ages 4 months to 5 years are at risk for developmental, behavioral, or social delays. Though intervention has the greatest impact before a child begins school, less than half of children with developmental delays will get the early assistance that they need. The First 5 Healthy Mental Development Initiative helps support your child's healthy mental development by creating a support system of medical practices and community-based services. If you're not sure where to turn for help in your community, chances are First 5 knows just the place to get your child and family the support you deserve. Visit this website to find out more.
So we receive donated medications and medical supplies from long-term care pharmacies, retail pharmacies, clinics, medical providers, even individuals. And these are drugs that have not been used, but they have been dispensed to the patient. So anything in tamper-evident, sealed packaging that is a non-controlled drug, those drugs can be donated to our program, and then we have pharmacists inspect these medications, and we turn around and provide these medications to safety net providers, so clinics, pharmacies, free clinics, community health centers. We provide these drugs free of charge, and they are dispensed to Iowans in need. Any patient in Iowa that is up to 200% of the federal poverty level and uninsured or underinsured for their prescribed medication can access this program free of charge to receive donated medications and supplies. There are now state drug donation programs legislatively created in over 40 states across the U.S. Iowa's program is special in that we have received support from our state legislature and the Iowa Department of Public Health and other providers such as the Iowa Primary Care Association. And through this funding, we're able to operate a statewide program. Other states don't have that bipartisan support, so it's been a struggle to get programs like this off the ground. So recently, in the last 4 years, we have been working with the justice community, and we now have programs established with county jails and with the Department of Corrections with the prison system to provide behavioral health medications to offenders when they are released from the justice system. We found that medication access and medication adherence is strongly connected to success in the community after release. When we look at the county jail population, here in Polk County we found that 25% of the jail population is diagnosed with a mental health disorder. That mental health disorder accounted for 44% of all bookings. When we look at how these individuals have done Post-released, so the first 90 days after leaving the jail system, we found that individuals with behavioral health disorders that use our program to access medications, their rate of recidivism is 8%, and that compares to a rate of 22% for individuals with mental health disorders that did not use our program.
Our pharmacy in Urbandale acts as a pharmacy where we can dispense medications to people who have difficult times in their lives where they can't afford medications. So people will come into our pharmacy and pick up their medications after they've been approved through the SafeNet RX program and their physician. Many of the people that come into the pharmacy to pick up their medications are people that can't afford medications because either they're in between insurance or they're very, very expensive medications that can't even afford even under their insurance program with their co-pays. So this acts as a secondary site to be able to provide medications to people that may not have been able to take them regardless if they had insurance or not. The program is a great program for people here, not only in our community, throughout the whole state of Iowa, because it does provide essential services, medications to people who may not be able to afford them. And with the rising healthcare costs, many families now are being squeezed by these higher prescription costs. So this SafeNet RX program is a good alternative to help people to get through the tough times in their lives and get them back on their feet so they can stay healthy and productive Iowans.
We've worked with a number of places that are using federal dollars to really take advantage of opportunities that do exist. And I think a lot of these opportunities relate back to the social determinants of health, whether it's clean water or a safe place to live or a strong, vibrant community. USDA rural development is at the table or should be at the table in all these instances. In a sense, we're a giant infrastructure bank. We're making loans or loan guarantees to make projects possible, especially in areas where the local bank doesn't have the capacity to do a big project. We can come in and help with that. And communities have taken advantage of that. And it has opened the door to do things that weren't previously possible. I just had the chance to attend a dedication or announcement for a $25 million wastewater treatment facility, which is going to enhance the quality of the water coming out of that large community and also enhance the quality of the groundwater. I can think of one town where we gave them a grant of $4,500. And they took that money and took an old abandoned grocery store and converted it into a combination Goodwill, secondhand shop, cooler space for the food bank, and a community kitchen. We're making these huge investments in rural health care. And many times there are components of that where they're adding mental health beds, which is dramatically needed across rural Iowa and frankly, rural America. They're starting to add addiction services, addiction therapy services. And we're also helping to invest in telemedicine and bringing healthcare services to places using video screens. And in fact, the University of Iowa got a grant from us a few years ago to connect about 60 rural clinics and rural hospitals to their specialists. Our work with rural hospitals and rural health in general also extends to our support for projects at federally qualified community health centers. They do health care, they do dental, they do mental health. I mean, those are the sorts of services that rural Iowans need access to. USDA Rural Development has invested over $300 million in high-speed broadband across rural communities over the last 7 years because they have access to information, they have access to resources that they wouldn't have otherwise. They're able to connect to friends and family, in some cases to physicians, to caregivers, to resource providers, things that wouldn't be possible otherwise. And there's no reason why there should be a digital divide. If you live in a small town, you ought to have access to the same high-speed connectivity that folks in urban areas have. We're hearing the stories across Iowa right now about water quality issues. We're playing an important role by giving communities, by giving rural water systems by giving regional collaborations for wastewater treatment, access to funds that they might not have otherwise. Rural development works closely with communities on facilities that the community considers essential to life in their town. It can be a fire station, it can be a community center, a library, or a school. Increasingly, we're working with food banks. Every year, hundreds of millions of dollars go to help support access to safe and affordable housing in rural communities. That continues to be the #1 challenge in small towns, is how do you make sure that there's enough safe and affordable housing in a rural community?
We are part of the Feeding America network of food banks across the United States. So in the state of Iowa, there are actually 5 food banks. We work together to share food, to share best practices. We go together up to the Capitol to lobby and to be advocates for those that are food insecure within the state of Iowa. The population of Iowa is roughly 3 million. And within the population of Iowa, about 385,000 Iowans are deemed to be food insecure. That's about 12.7% of our population. In the state of Iowa, 1 in 5 children are deemed to be food insecure. We know that children that are food insecure suffer from more headaches, more stomach aches, they have more colds. They also have more iron deficiency anemia problems, more hospitalizations, and more chronic illness. We also know that they have more behavioral issues in school. We do know in the state of Iowa that 1 in 8 adults are food insecure. Adults that are food insecure are more likely to have high blood pressure. 1/3 of the adults that are food insecure are diabetic. I know firsthand from visiting with food insecure seniors that are in line at mobile pantries that they make tough choices between paying medical bills and buying food, paying their utility bill and buying food, rent and buying food. We know that access to adequate, nutritious food is a strong determinant of health in Iowa and across the United States. So we work every day to procure more fresh produce, more meat, more fruit, but those are things that aren't readily donated to us on a regular basis. So that's where donations play a particularly big role. We receive USDA commodity foods from the federal government to distribute. We receive food from wholesale partners, large manufacturers that perhaps it's not met a quality check or it's not labeled properly. We receive food from retailers where the food may have expired for some reason or again doesn't meet their quality check. It's still edible, but not something they want to retain on their shelf. And then of course we receive food via food drives. And then again we buy some food as well. For every $1 donated to us, we can convert that to 4 meals. Once it comes in our warehouse, we check it for quality. We inventory that, we rack it, and we endeavor to get it out the door as quickly as possible to people that are food insecure. That food goes to those that are food insecure in a variety of ways. We partner with several hundred agencies across the state of Iowa, so that food may go to a traditional food pantry, or we also work with schools. So we now have school pantries where the food may go to a school pantry where we know it's more readily accessible by families.
Lifelong Links is Iowa's Aging and Disability Resource Center. It's staffed by the area agencies on aging across Iowa. Iowa has 6 regions of area agencies on aging, and within those regions there are 15 different locations called coordination centers. And they are staffed with individuals to receive information and referrals around basic needs that individuals may be looking for, or maybe even looking for support on complex situations as they're supporting loved ones. Citizens across Iowa can access the Aging and Disability Resource Center, Lifelong Links, by either calling the 866 number. You can also access the Area Agencies on Aging by the Lifelong Links website. Or you can go into any of the coordination centers, contact them directly, walk in for information, and we'll also meet individuals in your home, or if you'd like to meet at someplace in the community as well too, we're glad to do that. The Area Agencies on Aging have information and referral assistance specialists. Those individuals are trained specifically to know what's available across community. We like to refer to it as Iowans helping Iowans, meeting basic needs, but also again looking for what may be happening on the current life journey as well too. We also have a role called the Options Counselor. That individual will spend a little bit more time with an individual or a caregiver. About 80% of the individuals who contact Lifelong Links are actually caregivers, caring for someone else. Typically it could be a spouse, it could be a brother, sister, maybe a friend as well. And just looking for that basic support. And the Options Counselor will go through a planning process with the individual and others if others are involved, and help them with putting together that plan so that they can see how the needs can be met. The types of services that the Area Agencies on Aging will work with consumers on are everything from basic needs such as food and nutrition, access to medication, funding for medication as well too, transportation, which is many times very key, just making sure that individuals can get to appointments and again stay independent as long as possible. Housing options are another area that's quite important. And the Area Agencies on Aging will support those who are aging. Typically it's those who are 60 plus, the caregivers as well too, that are supporting those individuals. And then we also support individuals that are 18 plus living with disabilities and working with those individuals to stay as independent as possible as well. One of the programs of the Area Agencies on Aging includes a nutrition program, and that includes both meal sites that are located throughout many of our communities and also Meals on Wheels, which is very important. Nutrition is a basic foundational need that is so important, obviously, to make sure that people are getting meaningful and good food, but also that aligns very much with medications as well too. It's important to have both food and medications working together as a part of the whole approach to ensure that people can stay independent and stay healthy in their place of choice. And many people refer to it as a check-in service. If people receive meals on a regular basis and there's consistently someone checking in on them many times on a daily basis, at least throughout the week. And it's just a good touch point. Many of the individuals that receive those meals are looking forward to not only the meal, but many times they're looking forward to the individual who's stopping by as well. And so that's such a critical point, not only in metro areas, but also specifically in rural areas as well too, so folks have that opportunity for that contact with someone else. Lifelong Links and the Area Agencies on Aging are really there for everyone. We're there for individuals who may need the direct support, but we're also there for those who are providing care and support to others. We're really there for any point in time. I call it the life journey, and so things happen when we maybe least expect them, and we're there to provide that support. Sometimes people just need a little bit of support. Sometimes individuals need a major plan to put in place, and we're really there for people with all walks of life.